Welcome to Medicare Monday. I'm Justin White, CEO of Senior Health Services. So glad to have you here. So as promised, our Medicare Advantage plan's good. We talked recently about Medicare supplements, very popular, been around for a long time. But our Medicare Advantage plan's good because if you go to social media, you're going to get a lot of opinions about it. I'm going to tell you right now, yes, they are. They can be controversial, again, because of social media, and we're going to talk through that today so that you can see some things and make a decision for yourself. That's the one thing I want to make sure we do, is that you get the information so you can make a decision and not have to listen to all the detritus and the billion different opinions that you're going to get from everybody. Because the only opinion that matters is yours at the end of the day. So what are Advantage plans? These are plans that are administered by insurance companies. They are mandated by the feds and overseen by the feds to cover A and B benefits of original Medicare at least as well as original Medicare or better, and most of them do cover them better. They cover them quite a bit better usually. They are basically, as I mentioned, federally subsidized group insurance plans that feel roughly analogous to maybe the employer insurance that you had while working, or maybe that you're in now. So if you didn't mind paying co-insurance and co-payments and a little deductible here and there, that's kind of what they feel like, and then they bring extra things to the table from there. People also like the fact that most of them don't have any premium. Most of them do not have a deductible, right? And if they do have a premium or deductible, they're very low, generally speaking, and they're all the major carriers. Pretty much every major carrier that offers a supplement usually offers an Advantage plan too, because they play both sides of that thing. And so what comes down to is a style of care. What style of care do you want? Do you want to pay a premium and really know kind of what's going on, and you want to have total access to everything, and you don't mind this premium that's going up every year because the access is more important to you? That supplement. If you would like to have the cost as low as possible, still have the doctors that you want to go see, but you just pay a co-payment and a co-insurance for different things up to a maximum, then an Advantage plan might be something that you would like, especially if you like extras, like a gym membership or some of the extra benefits that may come along for the ride. Make sense? When people complain about Advantage plans, they might complain about having to get a referral if they're in a plan that requires one, or the pre-authorization might be taking a little bit longer than what they would prefer. They may have a doctor in their ear about the paperwork and annoyed by that, or just, any number of things. Their doctor may have left the network and now they're having to change doctors. That's where you call us and we try to find that doctor and get you moved somewhere and keep your care team together. That's our goal. But generally speaking, if you look at the polls for not only Advantage, but also supplements, you're going to find people that are generally very, very happy with both of them, so long as they were each properly placed where their care preferences happen to be. If you ask a supplement person about an Advantage plan, you are going to get an earful, and it's not going to be pleasant usually. If you ask an Advantage plan if they want to pay a premium for a supplement, you're going to get some colorful language from them because they generally like what they've got. And that's the most important thing that I could tell you, because you need to understand what the differences are between them, how they work, so you can make a similar decision. If you have any questions, let us know. SeniorHealthServices.com. We're not associated or affiliated with the federal government at all. We're completely independent, and we're licensed to help you with this. We'll see you next week on Medicare Monday. Thanks for watching.